Feels like I've opened my eyes again, and the colors are golden and bright again. There's a song in my heart, I feel like I belong. It's a better place since you came along. It's a better place since you came along.
Welcome, everyone. We're so happy that you could join us today. We are going to be discussing a topic that we believe you're going to find very interesting. We're going to be talking about our metabolism. Additionally, we're going to discuss metabolic syndrome. Specifically, we're going to talk about diabetes and other metabolic disorders and how nutrition and common sense exercise and activity can assist us with this. So let's get started with our program. We're going to introduce you to a nurse practitioner, Marilyn Millord. She is going to be interviewed by our senior coordinator, Leilani Rangel. Marilyn Millord has been a pre-anesthesia nurse practitioner with Team Health Anesthesiology at Englewood Hospital for the past 3 years. In her role, Marilyn performs comprehensive anesthesia evaluations on patients scheduled for surgery. She routinely reviews and triages cases that stand out as potential issues for patient safety. To assess patients' readiness for surgery, Marilyn orders and then interprets pre-surgical tests, collaborating with surgeons and anesthesiologists to ensure that patients are prepared and optimized for surgery. Prior to working with the Department of Anesthesiology, Marilyn worked as a nurse practitioner for patients in a primary and urgent care setting. Even before becoming a nurse practitioner, Marilyn provided care to those experiencing vascular trauma, as well as orthopedic and perioperative patients who would be admitted to the hospital for surgery. Marilyn also handled case management and served as a clinical instructor. As the pre-anesthesia nurse practitioner, Marilyn also provides care for patients for whom blood transfusions are not an option, but who may have anemia and need surgery. She guides these patients to use their autonomy to make choices and advocate for themselves. Marilyn feels that her relationship with bloodless patients has sparked a profound understanding in the way that she practices medicine. She says, anemia can be serious, and if left untreated, can have long-term effects on patients having surgery and anesthesia. Bloodless medicine gave me a blueprint on how patients with anemia should be cared for. So, let's hear from Marilyn and Leilani.
Thanks so much for that introduction. And Marilyn, thank you so much for making time to speak with us today about anemia. Now, this is a really important topic, yes. Can you tell us a little bit about what anemia is?
Anemia is when you have low hemoglobin, which is an iron-rich protein in your bloodstream. And it varies from male to female. Children, for female, it's less than 12. So anything less than 12 is considered anemia. And for a male, anything less than 13 is considered anemia.
Is it any different for a child?
Yes, it is. But it depends on the child's age. So there's more involved. Age and, of course, sex, male, female also.
Understood. Okay. So do most people know if they're anemic? What are some of the symptoms?
No, actually, that's a good question because it's probably the most challenging for us, and probably for patients, because anemia symptoms are very subtle. You know, you can feel tired, but if you're working hard, you're doing other, your mom multitasking, then that could seem normal. So it's very subtle, and most of the time, it's really quite incidental finding, kind of. For us, our patients who are having surgery, it's required that they have blood work. And that's when we find out that they're anemic. A lot of times it's not known.
So even the patient might be surprised that they're anemic.
Absolutely. Almost always.
Wow. Okay, so aside from feeling tired, are there any other symptoms of anemia?
Palpitations is very common, although palpitations can be sort of like a symptom for thyroid issues, and it's missed a lot of times. But palpitations, headache, nausea, muscle aches, and in rare cases, you have someone who, it's called pica. They crave for anything that's non-food, which would be ice, dirt, Yeah. Try.
Wow.
Yeah.
Wow. Okay. All right. Does a person who have anemia look any different?
Sometimes it depends on how anemic they are. Yes,
Okay.
because you'll have the eyes, right? You'll have in the lacrimal, you'll see very pale, um, and a lot of times dryness. So you have cracking around the lips, yeah, it can be known. I mean, it can be obvious, but um, you have to be to the point where you need help.
That's like a very serious anemia when it
Yeah,
gets to that point.
exactly.
Okay. So there's a constellation of symptoms, but sometimes they're hard to put together to create the anemia picture.
Exactly.
So really the only way to be sure is through a blood test?
Yeah. Blood test.
Okay. All right. So in our day-to-day lives, how can anemia affect us? You mentioned tiredness, but is there other ways that anemia can affect us?
Yeah, low energy and a sense of I don't want to see it's almost like a will. You know, you don't have the drive to do your normal task. So, but it's just a sense of just not wanting to do things, not wanting to get out of bed or, go to work or do anything that's sort of strenuous, any strenuous activities.
So it can look
So,
like depression.
yeah, yeah. Thank you for saying that.
Okay.
Because sometimes, and then, yeah, and then you have someone who's chronic anemia. Sometimes they are depressed because of the illness.
Yeah. So wow. So even if a person's feeling depressed, it would make sense for them to still get checked out medically because it could be a
Absolutely.
sign that they might be
Oh,
anemic. Okay. Um, can people pass out or feel dizzy
yeah.
or have brain fog if they have anemia too?
Yes. They can. Yeah, they can. Yeah, they can have fainting spells.
Wow.
Um, but they are so sporadic that a lot of times still, um, patients or people in general are not seeing it as a sort of like, this is a time I need help. I need to find out what's going on with me. Yeah, you can. You can have fog, brain fog, because remember, hemoglobin carries oxygen. So you're not getting enough oxygen throughout your body, and that's including your brain, right? Your heart, your brain. And that could be the reason that you feel a little foggy and, and feel like you lightheaded and want to pass out.
Is anemia more common for certain people than for others?
Yeah. It's more common in females, especially childbearing years, someone who's having heavy cycles. That's very common. Elderly population, they get missed a lot because they're not able to keep up their nutritional status, right? And that's usually the main reason, by the way, unless they have an underlying medical issue that's causing it. But yes, our elder population and female in childbearing years, pregnant women tend to be. And again, I'm going to bring in, because we forget our little pediatric population. Yeah, they're also.
Yeah,
can be
nutritional
in their
deficiency
Exactly.
if they only want to eat
Exactly.
chicken fingers and fries.
Right.
So I guess that's not the appropriate food to fight anemia. If we want to fight it with food, let food be our medicine. What foods should a person eat to prevent anemia or to improve if they have anemia?
Yeah, so this is, I mean, it sounds simple, but it's a little tricky, right? Because we have vegans, we have so many different diets out there. But for the most part, iron-rich foods, right? Legumes, right? Which could be green leafy vegetables, beans, organ meat. I know it sounds, liver, kidneys, things like that can help. And adding iron supplements. So iron supplements work if you're eating healthy, right? You can't take iron supplements or any kind of supplements and you're not eating healthy. So if you do the combination, yeah, that helps. And we do that a lot, with my patients that are anemic, even if I decide to treat them, but to start them off just so they can feel better, just give them a little cocktail of iron supplements and vitamin C, B12, my folic acid. So
those are things you could find over the counter.
over the counter. Thank you.
Beautiful, beautiful, very good. So we kind of discussed what are the other treatments for anemia, this supplementation. But if a patient's very concerned especially, our audience includes many moms, women, the elderly population. What should they do?
Yes, be proactive. Educate yourself, right? We have a lot of patients and a lot of people that are known anemic, like they know they have it, and it becomes sort of complacent. This is what I live with. No, and that should never be acceptable.
Yeah, I've heard.
It can be better.
Yeah, and I've heard a statistic that 1 in 3 people are anemic. So it's very common.
It's very common.
Yeah.
Very,
yeah.
very common.
But it doesn't mean it's normal.
That's right.
Okay. All right.
So absolutely, advocate for yourself. Be in the know, right? Educate yourself, and seek out someone that's really will understand your belief system or whatever treatment that you choose, and they can accept that, right, and respect that. So it's very important.
Well, thank you so much for making time to speak with us. We all appreciate it very much, and we're very grateful for how you help so many of our patients here at Englewood Health.
Really, Lonnie, it's my pleasure. It really is.
Okay, we're going to turn it back to you now. Thank you.
Well, thank you, Leilani and Marilyn, for being here with us today. That was wonderful. We appreciate it. Well, next up on our program, we're going to introduce you to Dr. Rhea Lim. Dr. Lim is an endocrinologist associated with our Bloodless Institute here at Englewood Health. She's board certified in internal medicine, endocrinology, and diabetes and metabolism. Dr. Lim received her medical degree from the University of Santo Tomas in the Philippines. She then completed her medical residency at the University of Connecticut School of Medicine, followed by a fellowship there in endocrinology. Dr. Lim treats a wide range of metabolic and endocrine issues, including adrenal gland disorders, all types of diabetes, hypertension and hyperlipidemia, hypoglycemia, metabolic disorders including bone disease, osteoporosis, parathyroid disorders, pituitary disease, and diseases and disorders of the thyroid. She is also a published author of medical articles on these varied subjects. So we'd like to invite Dr. Lim to join us. Hello.
See, thank you so much for having me.
No, not at all. We appreciate it. And we appreciate the fact that you have such a vast array of specialties having to do with the metabolism. So let's get right into the subject of diabetes, because many people have come to our seminars looking for that specific kind of direction. So let's establish again, what is diabetes? What actually not causes, but is diabetes?
So I think it's very important for all of us to learn more about diabetes. Diabetes is very prevalent. It's estimated that more than 30 million Americans have diabetes, and unfortunately, a good percentage are undiagnosed. As much as 10-20% are undiagnosed. So what is diabetes mellitus? So diabetes is basically a problem of regulating sugars. Our body's not able to process the sugars properly, so the glucose levels in the blood are high. And with that, it can create a lot of issues, which we tend to be very familiar with.
Okay, how can we be tested for diabetes?
It's a good question. So diabetes in a lot of patients can have no symptoms at all. Sometimes they can present with increased thirst or urination or blurring of vision, but it's really about testing the blood. So for diagnosis of diabetes, it's about testing blood glucose levels. Usually it's a fasting glucose, which your healthcare provider or primary care provider can easily do. There's also what we call as a hemoglobin A1C, which is a 3-month average, or represents a 3-month average of glucose. And there's also what we call as a glucose challenge test, wherein you're given a glucose drink and have your glucose or blood glucose tested a couple of hours later.
Well, that makes sense. So would you suggest then that if a person has never been tested, that they should ask their primary care physician, what are my numbers?
Definitely. So especially if somebody's at high risk. So who do we recommend for diabetes to be screened? So anybody 45 years old and above should have their blood tested for this. Those who are younger than 45 who have some risk factors like family history perhaps of diabetes, or being overweight or obese would be another thing, or having other medical conditions like PCOS or polycystic ovarian syndrome, or perhaps be on some medications that may increase their risk for diabetes. So definitely a conversation with your primary care provider or your health care provider.
I think that we tend to not really make an association between diabetes and the health risks that can follow. What are some of the health risks of undetected or untreated diabetes?
So with diabetes, because a lot of times people are asymptomatic, don't present with anything, so we might think, oh, I don't have diabetes. But we know that with diabetes, when somebody has high sugars, there's increased risk for complications like blindness. It is the leading cause of blindness in the US.
Oh, I didn't know that. Wow.
Certainly, and also heart disease is another risk with uncontrolled diabetes, kidney failure leading to hemodialysis or dialysis, even amputations because of vascular diseases from uncontrolled diabetes. So definitely making sure that we are all screened for diabetes, and if we have diabetes, making sure that it is better controlled.
That makes sense. Thank you. And as I'm listening to the many things that diabetes can cause, it's making me think that something so small as going and getting tested and knowing what your numbers are, it can be so vital to prevent all of these things from happening, because they happen quickly, don't they? They start to escalate once the person presents with these problems.
Yes, because a lot of times you may not know it. So when you see your doctor, the diabetes may have already been brewing for a couple of years. If you haven't seen your doctor for a number of years or haven't had your blood tested for a number of years, it may be already ongoing.
So there are different types of diabetes, and we often hear of type 2 diabetes on every commercial that comes constantly on television. What's the difference between the different types of diabetes?
So with regards to type 2 diabetes, so that is the most common type of diabetes. It's the one that we're most familiar with. Basically, with type 2 diabetes, it's a problem of insulin resistance. Our body is able to produce insulin, but it is not able to utilize that insulin properly, leading to that high sugars. Usually with type 2 diabetes, it's associated with sedentary lifestyle or with a poor diet, or perhaps being overweight. That would be the usual type 2 diabetes. On the other hand, another type of diabetes is what we refer to as type 1 diabetes, wherein it is an autoimmune disease wherein the body's pancreas, which is the source of insulin, is destroyed by an autoimmune reaction. Thereby, the body is not able to produce enough insulin. So the problem with type 1 diabetes is the lack of insulin. And type 1 diabetes is usually associated with younger patients or patients who tend to be lean. But it can also be seen in older patients. And with type 1 diabetes, since the main problem is the lack of insulin, almost always they need to be on insulin for treatment. And then another common type of diabetes would be gestational diabetes or diabetes in pregnancy. And it is also a problem of insulin resistance, and that is because of the placenta causing the insulin resistance, or the insulin is not effective. In most patients with gestational diabetes, they can have, they may have the high sugars during the pregnancy, but it doesn't automatically follow that they will have diabetes afterwards. They may be at higher risk for diabetes in the future, but not necessarily have it.
That makes sense. So basically, I go to the doctor and the doctor says I have diabetes. So immediately that means I have to go on insulin, right?
Not necessarily, unless if you have type 1 diabetes, as I mentioned, wherein almost always it would be insulin. But for the type 2 diabetes, which is the one that's more prevalent, there are a lot of medications available now. We always categorize or classify diabetes medications as insulin, or it could be the non-insulin agents. So for the non-insulin agents, it can vary from injections to pills. With the non-insulin agents, now there's like about 10 classes or kinds of diabetes medications, and each of them act in a specific manner to help control the glucose.
Basically, then, if we are screened properly, there are medications that we can use, right? That doesn't necessarily jump, like you said, to insulin. But tell me more about those different classes of medications that we can be on to prevent our diabetes from worsening.
There's more than 10 classes of diabetes medications available, each one acting differently, and each one can act together to help control the diabetes or the glucose. So some of the diabetes medications would help promote insulin release. Some would help make your body more sensitive to your own insulin production, or perhaps reduce the sugar production from the liver, or even some medications would promote lowering of the sugar through the kidneys. Yeah, so there's now a lot of options for diabetes medications depending on what other medical conditions you might have, perhaps. That would be taken into consideration as to which one is most appropriate.
You mentioned the kidneys and how they work and so forth. Undetected or untreated diabetes, what relationship does that have to the kidney? How can that affect our kidneys?
So with diabetes, because of when the diabetes is uncontrolled, there's a large glucose load or sugar load in the blood that would also damage the kidneys and thereby leading to kidney failure. It can also possibly damage other organs like the heart, causing those blockages leading to heart attacks or even strokes. So with diabetes, that high glucose load in the blood can cause havoc on multiple organs.
Now, I know that there's nothing that we can do about our genetics, but if we wanted to really prevent diabetes, is there anything that we can do?
Definitely. So yes, you are exactly right. If we have the genes we're given, but certainly we can do something. And lifestyle is extremely important. Having a healthy diet, lower fat, lower carbohydrates, minimizing the added sugars. We're all inundated with processed foods. Certainly trying to curb that, minimizing the added sugar in our diet. That's extremely important. Exercise will also help. That helps you utilize the sugars, thereby bringing it down. So very important, diet and exercise. It doesn't mean doing a fad diet. We're talking about cleaner eating, just going back to the basics.
And so if somebody has a family history, or if they already know that they're pre-diabetic, does it make sense to see someone like yourself, who is a diabetes specialist and endocrinologist, to be able to get the right direction?
Sure. So with diabetes, it's always a multi-team approach. Either it could be seeing a specialist, perhaps, or your health or your primary care provider, and also considering seeing a dietitian who can help you with meal planning, making sure that you are doing the right choices. I think it's really about making a conversation with your healthcare provider that you're in this in terms of working to help prevent progression. And that's extremely important.
Well, thank you so much. We've been enlightened and really good information. Thank you for joining us today.
Thank you.
Well, we really appreciate Dr. Lim's coming and spending her day with us today and being part of our seminar. Well, now we're going to introduce Sonia Solomon, who's going to be interviewed by one of our coordinators, Richard Carter. Sonia is a certified exercise and professional trainer who works at Englewood Hospital's Graff Center for Integrative Medicine. Sonia received her bachelor's degree in exercise science and sports studies from Rutgers University in 2009. She continued her love of fitness as an instructor and assistant program manager at Little Gym, instructing children of 3 months to 6 years of age in dance, sport, gymnastics, and exercise. Sonia then applied her skills when she spent several years in the rehabilitation medicine department here at Englewood Health, both in the inpatient and outpatient units, alongside physical and occupational therapists. Sonia spent years assisting patients with exercises to help them return to their normal daily activities. She obtained her personal training certification through the American Council of Exercise in 2016, where she also completed their Senior Fitness Specialist program. Sonia has also provided continuing education in corrective exercise, low back health, nutrition coaching, and strength training. Since obtaining her personal training certification, Sonia has done in-home training sessions for people of all ages and fitness levels. She has also led group classes at the Graff Center for Integrative Medicine at Englewood Health. Sonia loves to help people achieve their health goals while having fun at doing it. So we'd like to introduce then Sonia and Richard.
Well, Sonia, I understand that you are a personal trainer.
Yes, that's correct.
Now, that tells me that you have something to do with training and that a person is involved.
That's correct.
But what does a personal trainer do?
So, a personal trainer is someone that's certified through a nationally accredited organization such as the American Council of Exercise. And you can find personal trainers in gyms, in rehab facilities, outpatient hospital settings, or we can come right to your home. And the goal of a personal trainer is to help you reach your fitness goals. So whether that be losing weight, increasing strength, getting started in an exercise routine, or maintaining one, our goal is to help you reach your goal.
Very good. So you're portable.
Exactly.
And exercise, there's always emphasis in the news about exercise and how important it is. But how important is exercise to health?
Exercise is vital in maintaining your health. The benefits of exercise are innumerable, and I'll list some just so you know. Exercise can help lower your blood pressure, help control your weight, help lower your cholesterol, including lowering the harmful LDL cholesterols and increasing the healthy HDL cholesterol. It can help strengthen your muscles, your bones, reduce anxiety, and just improve your overall well-being.
What about metabolic disorders like diabetes? Does exercise help that?
Definitely. Exercise can not only help stave off those metabolic disorders, but can help you maintain a healthy lifestyle if you already have. So studies have been shown, say for example, for women, if they partake in 4 hours of moderate exercise during the week, such as walking, or even vigorous exercise like running during the week, it can help stave off heart disease for women who are already diabetic by 40%. And exercise can help lower your hemoglobin A1C levels and reduce your body's resistance to insulin.
Cool. Well, what about those who are mobility challenged? Surely there's no way for them to exercise.
No, there's definitely plenty to do if you are mobility challenged. There are exercises that you can do in a chair, on your couch, or even on your bed. And I'll show you some of those exercises later. But say you can't tolerate the 30 minutes of recommended daily exercise, what you can do is split that up. So tell yourself, I'll do 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes in the evening. And that's just as effective as doing all 30 minutes at once.
I park my car in the farthest parking space possible to go to a store. Is that kind of like sneaking in exercise?
That's a great way to get in physical activity during the day, for sure. You can park your car far away from the store. If you're going to take stairs instead of taking an elevator, that's another great way to boost your physical activity during the day. If you like to dance, dance when you can. If you're watching TV during the commercials, get up and move around. These are great ways to help impact your health. And remember, little decisions throughout your day can have a big impact on your health.
All right. So would you kindly demonstrate for us some of the exercises that can be done, say, in a chair or that we could do at home?
Sure, I would love to. I'll show you now.
All right.
Well, thank you guys for joining me. I'm going to be demonstrating some exercises for you guys that you can do right at home, sitting in your chair or standing up to help you get moving during your day. So the first thing that we can do is just warm up our bodies. We can start by just a general walking in place. This is something that you can do if you're not mobile enough to get up out of your chair. What you can do is even sit in your chair and march in your chair. You can put your arms out for even more resistance. Keep your core in nice and tight. It's very important before you start working out to warm up those muscles. Think of your muscles like a rubber band. If you take an old rubber band out of the drawer and try to pull it real tight, it's gonna snap. You wanna very slowly warm up those muscles to get them ready for your exercise. So once you get warmed up and you feel like your blood is flowing a little bit, we can do some dynamic stretching. Dynamic stretching means we're gonna stretch while we're moving. So we can put our legs out nice and wide, arms out, and we're gonna reach down to your toes, back up, and the other side. Now, if you're incapable of reaching all the way down, that's fine. You have to take things to your own level. If that means coming down and touching your knees and coming back up, that's great. You have to do what works for you. So we're gonna keep stretching out and moving, getting our blood flowing, increasing our heart rate nice and slow. Very nice. Let's circle our arms back to open up our shoulders, forward, and let's backwards and forwards. Good, let's give ourselves a nice big hug. Open up, nice big hug. Really stretch out those chest muscles. Very good. Now we can come by our chair. We're gonna work on some leg exercises. So the first thing that we can do are called hip abduction exercises. We're gonna kick out. And if you're not capable of doing this exercise standing, what you can do is even laying on a mat or in your bed. Just lay down and you're gonna kick out and back down. Again, your core needs to stay nice and tight while you're doing these exercises. If you're not keeping those abs in nice and tight, you might feel later that your back may be sore. So that's no good. We want to make sure at all times we keep the abs nice and tight while we do these exercises. Once we're finished on one side, you can do 10 to 12. We can go right over to the other side and work our other leg as well. So these hip adduction exercises will really help strengthen your hip muscles all the way down to even your quadricep muscles. We're gonna keep our legs nice and straight. If again, you have to do everything to your own limit. If you're incapable of going all the way, that's okay. If your range of motion is just getting up and coming back down, that's okay. We wanna make sure we're maintaining our posture here, shoulders back, chin tucked, abs are in nice and tight. And then once we finish with 12, we can turn the chair here and we're gonna do some kick backs. So this is really working on our hamstrings and our glute muscles. Again, standing up nice and tall, shoulders back, chin tucked, and your abs nice and tight. We're gonna do 10 to 12 on each side. Again, according to your limit, if you feel that 10 is a lot for you, 10 is great. If you think you can push and do a couple more on each side, feel free. And remember, I'm demonstrating these exercises. Once you do this, you can actually go back and do the whole circuit all over again. So once we finish with one side, we're just gonna go right to the other leg. We wanna make sure we're not just working on one part of our body, but on both sides. And again, for you, if you're not able to kick back all the way, that's okay. If it's just getting your foot off of the ground and back down, that's wonderful. You just want to make sure you maintain that proper posture. And then what you can do next is we're going to do kick ups. So we're really working right here on our quadricep muscles going up into our hips. We're going to march nice and high on both sides. You can hold on to the chair if you need for stabilization. If you don't, just for a little extra, you can put your arms out in front of you and bring your knees up. Good. This can be done for about 30 seconds. Very good. And remember, everything is to your own level. If you're not able to get your knees up all the way and this is a simple march for you, that's okay. As you work on your strength and your flexibility, you'll be able to reach up a little bit higher next time. Very good. We're going to do this for a few more seconds. And make sure we keep breathing in through your nose, out through your mouth. Very good. I don't know about you guys, I'm already feeling a little bit warm. We get that blood flowing, we're increasing our heart rate. Very good. So the next exercise we can do is right on our chair. We're gonna incorporate the chair and work on our shoulders and our arms. So the first thing we can do is some tricep dips right in the chair. So I'm gonna show you from the side. We're gonna put the chair like this. And you can either use the armrest of the chair or the chair itself. You're gonna scoot to the edge of the chair, shoulders back, and we're gonna go up and down. Again, to your own level. If it's very difficult to go up and down too much, what you can do is just a little off the chair and back on. A little off and back on. If you are able to, and you have a steady chair that doesn't move, you can go up and down. This is a really great exercise for opening up the chest, working on your triceps. We're gonna do this for a few more seconds. Great. The next exercise we can do is sitting in the chair or standing, depending on what's comfortable for you. I brought some weights with me today, and we can do some bicep curls. So it's also very important, we just worked on the triceps, which are on the back of our arm. Now we're gonna work on the biceps in the front. So what we're gonna do is either standing or sitting. You can start at the edge of the chair or standing up, shoulders back, chin tucked in, abs in nice and tight, and we're gonna come up and down. Now, if you don't have weights at home, that's okay. You can take 2 big water bottles, 1 in each hand, 2 cans of soup. If you have resistance bands, you can use resistance bands, whatever works best for you. So we're gonna do a few more of these, about 5 more. 3, 2, and 1. Wonderful. So the next exercise, we can stand up. You can keep your weight in your hand, and we're gonna do a slight bend in our knees, shoulders back, weights down below us, and we're gonna pull up and back down. Again, maintaining that strong core. We wanna make sure our abs are in nice and tight. Just picture trying to squeeze yourself into that tight pair of jeans that used to fit. You really have to squeeze in those muscles. Squeezing your core does not mean not breathing though. You want to keep breathing as we do these exercises. Very good. And just to show you, if you're unable to do this standing, you can still do this in the chair. You're going to come right here to the edge of the chair. And same thing, shoulders back, chin tucked, abs in nice and tight, and we're going to come up. So remember, like I said before, even if you are limited mobility-wise, you can still get in a great exercise during the day. Very good. So I'll end with one last exercise and then we'll do some stretching. It's also very important that we stretch at the end of each exercise because we have opened up those muscles and we want to make sure that we can cool them down in a proper way. The next exercise we can do, again, standing or sitting in your chair, is with our weights. We're going to work on our shoulder muscles. We can go forward and to the side. Forward and to the side. And again, your range of motion may not be what my range of motion is, and that's okay. What's more important is that you do the exercises properly. So for you, if you're only able to come up to here or just go out to a 45-degree angle, that's completely fine. You want to make sure you maintain that posture, abs in nice and tight. We're going to go forward and to the side. Very good. I'm going to put the weights down and we're going to do some gentle stretching. So just as we did before, we can just start with our arm circles back. We worked on our shoulders a little bit. We want to make sure our muscles are nice and loose. We can go forward. Very nice. We're going to stretch out our arms. Remember, we worked on our biceps and our triceps during this little exercise. So even though we just exercised for a few minutes, we were able to work on muscles from our head to our toes. So you can do this right at home, on your chair, on your couch, or even your bed. Next exercise, we're going to put one leg over the other and reach down. Really stretch out those legs. Stretch out our backs. We're going to hold for a few seconds. And then very, very slowly come up and open up your body. We're going to do it one more time on the other side. We're going to come all the way down and stretch. Hold this for a few seconds. Very slowly come up and open up your body. Most importantly, always have some water with you when you exercise. You want to make sure you stay hydrated, and if you need it, like I do right now, make sure to make use of it. Thank you so much for joining me, and I'll see you soon. Well, Richard, what do you think?
Well, I think that's simple enough that even I could do it.
Exactly. Anyone can do this, and you can do it at home. You don't have to get up, pack your bag, go to the gym. You can do it from the comfort of your own home.
If we come to the Graph Center, would you show us a tailor-made exercise program that we could practice at home?
Definitely. I can definitely help you with that and help you reach your fitness goals.
Very good. Well, thank you so much for spending time with us today, and I wish you great success in the Graph Center and everywhere else too.
Thank you very much.
Well, now we'll continue with our program.
Thank you, Sonia. That was great. We really appreciate your getting our blood flowing there. And Richard, thank you for interviewing Sonia. So now we'd like to introduce Mary O'Connor. Mary is a diabetes nurse educator at Englewood Health. She serves as the Diabetes Program Manager for Englewood's Diabetes Education Program, which has been recognized by the American Diabetes Association for quality self-management education. Mary is a certified diabetes care and education specialist and has served in this field for over 30 years. She continues to provide those with diabetes the knowledge, skills, and support to live a healthy lifestyle. In addition, Mary was recently presented with a Lifetime Achievement Award from the Diabetes Foundation for her outstanding contribution to diabetes education. Mary has provided education to large and small groups of diabetics and those with prediabetes, including giving presentations to large groups of bloodless patients throughout the tri-state area. We're looking forward to hearing from you, Mary.
Welcome, everyone. Thank you very, very much for joining me on this journey. I'm going to be talking about the role of nutrition in the prevention and treatment of diabetes and other diseases. I specifically added other diseases because healthy eating is healthy eating, regardless of whatever the disease entity may be. What is prediabetes? Prediabetes is a wake-up call. It means that your blood sugar level is higher than normal, but not high enough to specifically say that you have diabetes. It's very important that if you do know that you have prediabetes, that you take advantage of the information that's going to be presented at this program. So some of you out there may also have diabetes. So there's a couple different types of diabetes. The first one is called type 1. The person is not producing any insulin, which is the hormone that controls the blood sugars. Counts for about 5 to 10% of those people with diabetes. It is autoimmune, which basically means the body has kind of gone against itself and has destroyed what we call the beta cells, which produces the insulin. And interestingly enough, we used to think of type 1 diabetes as a disease of young people, but we're now finding that seniors can also be diagnosed with type 1 diabetes. However, type 2 diabetes is the most prevalent one. All right, 95% of the people with diabetes usually have type 2. That means that you're still producing insulin, but it's not working as effectively as it should. You're not making enough insulin as well. And then we have gestational diabetes. So some of you women, not necessarily any of you men, might be dealing with this. This is where you have diabetes during pregnancy. And about 50% of the women that do develop gestational diabetes will go on to develop type 2 diabetes. So now we have insulin resistance, all right? Insulin resistance is when the hormone called insulin is not working as well as it should, and that is the hormone that controls blood sugars. The insulin is the hormone that gets the blood sugars into the cells so the cells can function. The cells need the energy that comes from our food. Well, insulin resistance can definitely be associated with a lot of different things, including prediabetes and diabetes. But let's add hypertension, let's add cholesterol, cardiovascular disease, obesity, polycystic ovary syndrome are some of the diseases that are associated with insulin resistance. We do have risk factors, all right? So what are risk factors for insulin resistance? Well, how many of you are older than 45? Got me there, all right? How many of us are overweight? I am also overweight. Sedentary lifestyle. I'd like to say that I'm working on that one, but I know right now all of you happen to be sitting down watching this, so right now you're a little sedentary, all right? Family history. Some of you may have a family history of prediabetes or diabetes. Heart disease or stroke. We're looking at cholesterol, sleep apnea, insomnia. Women, polycystic ovary, and non-alcoholic fatty liver disease. These are some of the diseases that are associated with insulin resistance. People don't realize that it's not just a big deal with the diabetes. Well, how do we manage all this insulin resistance? All right, we manage it with healthy eating. Healthy eating can prevent obesity, it can prevent heart disease and type 2 diabetes, blood pressure issues, kidney disease. It can also prevent some cancers, this healthy eating business. Osteoporosis. All right, as we get older, our risk for osteoporosis is there, but healthy eating can help prevent it or minimize it. Depression, tooth decay. I also don't love this statistic. 45% of deaths from heart disease, stroke, and diabetes are directly associated with poor diets. Do you realize how many people would still be around if everybody would just eat well? Diet is the leading risk factor for dying from a chronic disease. So, what diet is the best diet for health? What does the science say? As you can see, we have a ton of different options for a diet. Most people, when you think of the word diet, You think of weight loss, all right? I want to lose weight, so I'm going to go on a diet. Well, we also have to think diet is a four-letter word, all right? We really should be talking about healthy eating. But as you can see here, there's only few of the many, quote, diets that are out there. You have the keto diet, all right? What's the keto diet? Let's see. You're really only eating fats and protein. You have the paleo diet, all right? You have vegetarian, and we're going to go through some of these a little bit later. And I'm sure a lot of you are extremely familiar with one or two of these that are up here. Well, when we talk about, quote, diet, that four-letter word, one of the questions I always hear is, well, how many calories do you need? Well, unfortunately, I can't tell anybody right now how many calories because it's extremely specific, all right? But what are calories? Calories are the energy in the foods that is measured, all right? If we take more calories in than what we use up, we start to gain weight. All right. When we look at the calories, it depends on the age, it depends on the sex, the size, the level of physical activity. Somebody that's a marathon athlete is going to need a whole lot more calories than someone that is sedentary. Americans consume more than 11% of their daily calories from fast foods. That's a lot of added calories. Part of the reason, unfortunately, sometimes is because the cost of fast food today is a little bit less expensive than sometimes going to the grocery store. So some people are trying to save money. Well, I can go, to McDonald's and get the dollar special. Well, I'm really not 100% sure if they still have that dollar special with the cost of everything going up. Foods that are high in calories are low in nutritional value, right? They provide empty calories. So for those of you that have your phone out, what I'd like you to do is I'd like you, if you can, go onto that QR code. That QR code is going to bring you to the website my.plate.gov, where you can get an estimate of how many calories that you should be eating. So it's actually kind of a good little resource for you. I give you maybe like 2 seconds to go ahead and take a picture on that one, or write down my.plate.gov, right? What I also want you all to do when we get through with this is I want you to think about what can you do to make some changes in eating healthy. And I want you to think of maybe just one or two things. Don't think of all the information I'm giving you, because then it becomes a little overwhelming. Think of one or two things. All right. So let's talk about what's food, all right? Food is made up of nutrients. And if you want to kind of call it, it's the bread and butter of what we need, all right? They make up the composition of the food. So all of our food is either going to be a carbohydrate, a protein, a fat, and some foods are actually combinations. All right, these are actually called the macronutrients. The first one is a carbohydrate, all right? Carbohydrate is what gets converted into glucose. That's what provides the cells the energy and the fuel in order for them to work. The brain uses the glucose that comes from those carbohydrates. So we're going to remember that when you start thinking about, well, maybe I'm going to go keto and not necessarily eat any carbohydrates. And a lot of times people then end up with a little bit of a fuzzy brain. All right, the next macronutrient is also protein. So what does protein do? Well, it transports oxygen and nutrients. It also provides some of the vitamins that we need in order to function, and some of the minerals, your iron, your zinc, your magnesium. All right, fats. A lot of people say, well, I don't want to do fats. Well, fats do serve a distinct purpose. They do protect our organs. They keep our bodies warm, although we didn't necessarily need a lot of fat this winter so far. All right. It helps absorb some of those vitamins that we do need, and it contributes to the production of vitamin E. Then we have the micronutrients, and the micronutrients are your vitamins, your minerals, and also water. We're not going to get into that. Right now, we're really going to be focusing on those macronutrients. So let's talk about carbs. So what are the carbs? All right. The carbs are the starches, the fiber, the fruit, and the sugar. Well, we have healthy carbs and we have less healthy carbs. Where are carbs? I kind of say to people when I see them, anything that comes from the ground is going to be a carbohydrate. It's going to have carbs in it. So it's your vegetables, it's your fruit. Now, there's two exceptions. There's nuts, all right? Nuts have a little bit of carbs in it, but they're mostly healthy fat with some protein. And there's olives. And where do we get olives from? Olive oil, right? No, where do we get oil from? Okay, the olives. All right, now, where is it found? It's found in grains, it's found in white bread, all right, healthy carbs, not so healthy carbs, your bagels, your yogurt, your milk, all right? Interestingly enough, when you're looking at your labels, if you see that little stamp right there where it says 100% whole grain, that's kind of a little bit new process. So if you wanted to try to find something that was healthier in the grain family, if you look at that label, all right, what happens is when you're looking at the label, look for that stamp. If it's 100% grain, it means that there's at least 16 grams of whole grain per serving, and all of the products in there are whole grain. 50%, it's telling you half of those grains are made up of whole grains. All right, and if it's just a basic stamp, it contains 50% of the whole grain. All right, about roughly 8 grams of grains are going to be in there. When you're looking at a label and you see refined, enriched, all right, all the good stuff has been processed out of that. So that is definitely going to help put on some weight. It's going to definitely create insulin resistance behind it. That's going to be our white breads. It's going to be on top of that, besides, it's going to be the sodas. It's going to be any of our protein bars that we do. Everybody thinks they're so healthy. They're actually ultra processed. Packaged foods are ultra processed. They are linked, ultra processed foods are linked to cancer. They can raise blood sugars. So whole grains, you want to choose 100% whole grains. The first product needs to say the word whole. Whole grain contains the bran and the germ. When they enrich it, they take that part off, and then we're really dealing with the middle. And then when they use the word enriched, they're now putting the stuff back in, all right, but it's not natural. You want to choose less ingredients. You want to avoid artificial flavors and colors and preservatives. Fiber, we are going to be talking about fiber. The higher the fiber, the better the product. You want to try sourdough bread, all right? Sourdough bread is easily digested. It's higher in fiber. And the yeast that's in it, the yeast culture, allows for the flavor, but it keeps it stable. Now, the other day, actually more than the other day, I bought a loaf of bread probably about 2 weeks ago. And why is it not bad? In 2 weeks, that should have been bad. It's still good. The bread is still soft, right? The problem with that is it's very high in preservatives. So these are some of the ones down here. You have the Dave's Killer bread. You have the Ezekiel bread. Also, sprouted bread are good choices for you as well, right? You want to know what that label means when you're reading a label. 100% whole grain. There is no refined flour. Made with whole grains doesn't tell me anything. I don't see the word whole in front of the type of grain. Good source of whole grain. All right, then that means that 15 to 25% should be whole grain in there. Multigrain, no idea. It's just a mixture of different grains. Most of it, some of it, none of it could potentially be whole, or it could be refined or enriched. So here are just some labels. All right, the first one is Wonder Bread. That's the bread I grew up with. All right, if we look at that label, all right, the very first ingredient is unbleached enriched flour. There's no whole flour in this particular product. The one that's right next to it, you see where it says whole wheat as the very first ingredient? That's what you're looking for when you're buying your grains. Now, Ritz crackers. Oh, baked with whole wheat. Is that so good? I'm not sure. I don't see the word whole as one of those first ingredients in there. All right. The other thing, if you look down far enough, you're going to see high fructose corn syrup. All right. That's one of the main causes for weight gain and obesity in the United States. All right. Obesity is a key factor in developing multiple diseases. Sucrose and high fructose corn syrup contributes to the development of fatty liver disease, insulin resistance. It can also create bloating and gas. It's everywhere. You have to look at your labels. It's in pretty much every single processed food, flavored yogurt, ice cream, cereals, right? They're added during the processing. They're not in the product naturally. Natural sugar is found in fruit and milk. Now, fruit is a carbohydrate. I hear this often. No, it's not. And I say, yes, it's a carb. It has natural sugar in it. It's a carbohydrate. There's no added sugar. Same thing with cow's milk. Cow's milk has lactose in it. Now, some of you might also be doing almond milk, all right? Almond milk, unflavored, all right, really has no carbs in it. It has a little bit of the healthy fat. Almond milk can easily be a choice for some of you. So now we're talking about fiber, all right? Fiber is only found in plant foods. It increases the sense of fullness without adding extra calories. Whole grain fiber increases our metabolic rate. Increasing our metabolic rate actually helps us burn some calories, and it promotes the loss of calories in your stool. It promotes gut health, and that's kind of a big topic these days. It improves blood glucose response. So if you have a high fiber product that does have carbs, fiber is a carb, your sugar may not go as high. So if you have diabetes or prediabetes, you definitely want to go for the higher fiber. It reduces heart disease, right? Diabetes. Where are you going to find these? You're going to find it in a lot of fruits. You're going to find it in a lot of vegetables. In fruits, the ones that are better are your berry family, but also it's good if you have fruits that you eat the skin of, because the skin is definitely the fiber part. Okay, so how can you prevent diabetes, prediabetes, and actually all these other diseases, and how can we reverse them? You can deal with healthy eating, which we went over a lot of good information in there. There's also physical activity, which is going to be covered. And then we also talk about weight loss. Just losing 5 to 7% of your body weight can improve blood sugars and also prevent other complications. It's my pleasure to present this. Thank you so much.
Thank you, Mary. We really appreciated that stimulating talk. And in speaking with Mary earlier today, she asked me to mention that if you live in the local area and you have a prescription for diabetes education, you can come and see Mary and make an appointment to speak with her. Otherwise, she really suggests that you speak to someone, perhaps your primary care physician or someone at your local hospital, and have a consultation with a nutritionist. Well, believe it or not, we're at the end of our seminar. So to close our seminar today, I'd like to introduce to you the manager of the Bloodless Institute here at Englewood Health, Ramon Correa. Ramon, please.
We hope that you have enjoyed today's virtual seminar. We have worked hard to make each and every one of these programs different, interesting, and above all, informative. We would like to thank Dr. Rhea Lim, Mary O'Connor, Sonia Solomon, and Marilyn Millord for their presentations and personal expressions. We appreciate the time and effort it took for all of you to be here with us today. Incidentally, if you enjoyed the talk given by Mary O'Connor, you are in for a treat. That talk was part of a much longer and more comprehensive presentation that you can find on our website. If you go onto our website again, yourbloodhealth.org, and search previous seminars, you will find Mary O'Connor's full talk. Friends, please remember that we are here to guide and assist you with your medical and surgical needs. You will soon see a slide that will direct you to where you can leave a comment on our website. Please leave any questions that you may have for us here, and we will get in touch with you as soon as possible. We look forward to hearing from you in the near future. We are the Bloodless Institute at Englewood Health.